Working as a haematologist means to me making a difference to patients' lives because we're treating patients with often very serious blood cancers and blood disorders, and being able to take them on a journey to treat them and provide optimal care. My job really comprises working as both a clinical haematologist, carrying out ward rounds, clinics, looking after patients going through their treatment, often for blood cancers such as leukemias or lymphomas. I also do laboratory practice and work in haematology, looking at bone marrow biopsies, reporting flow cytometry, and integrating laboratory practice with the clinical side of work as well. New Zealand offers some unique opportunities to come and work as a haematologist. The close-knit, collegiate approach to management across the country is fantastic. I sort of fell in love with the lifestyle in New Zealand. Beautiful place to live, great places to see, amazing scenery, and just a more laid-back way of life with great access to the outdoors, which is really attractive. I have young children, so often at the beach and going to parks and things like that. The work-life balance is really encouraged a lot in New Zealand, and people definitely make the most of being outdoors and enjoying time off work as well. New Zealand provides a really useful environment to do that, and there's real opportunities to travel across the country, connect with colleagues in conferences and special interest groups, which ultimately is able to provide really good patient-focused care. There's definitely opportunity for growth in New Zealand.